Hey everyone, it's Dr. Brad Gandolfi, and today I'm going to be going over 5 questions on fat transfer breast augmentation. Fat transfer breast augmentation is a hot topic right now. There's probably not a day that goes by that somebody doesn't call my office requesting information on fat transfers for breast augmentation or trying to schedule a consultation. But it's not the right procedure for everyone. So today I'm going to go over 5 questions for breast augmentation, done with a fat transfer. Let's go. So let's talk about expectations after a fat transfer. What can you expect? Well, I wouldn't expect implant size breasts. Instead, what I would expect is a soft, natural enhancement in your breast. And if that's what you're looking for, then a fat transfer might be the right call. So that leads to the next question. What kind of expectations should you have when you're trying to increase the size of your breast using fat? And that really depends upon how much fat we're going to transfer. So for me, for most people, my target is about 300 cc's or milliliters of fat per breast. In order to do that, I generally have to remove about a liter of fat from somewhere to get enough fat to then process and bring down to that number. So, and that's the exact number actually that I got out of my patient 2 days ago. Now, there's some variability to that. Some people are going to have more fat, some people are going to have less, some people need more fat because they're going to be larger. And so it does depend a little bit upon your expectations, but you have to have some fat. You have to have enough fat to transfer to be able to do this procedure. And then the expectation has to be that that fat volume that is transferred is going to decrease. And I generally say about 60% of the volume is going to survive, and about 40% of that volume you're going to lose. So, my patient was ecstatic about how it looked immediately after the surgery, but I had to discuss, and we discussed this multiple times before she ever came in, that is not a final result. That is not a possible result with fat transfers. That really is a breast augmentation result that she had yesterday. It's going to soften and look much more natural as time goes on. All right, and then that natural volume really takes about 3 months to fully set in there. So who isn't this procedure good for? If you really like the augmented look of a breast, then this is probably not the procedure for you. This is for somebody that wants natural looking volume. When the fat is transferred, it always kind of creates a more natural, a more softer look and feel of a breast than an implant would. So if you really like, a breast augmentation style look with a lot of volume on the top of the breast, then you probably want to go with a breast implant instead of trying to do a fat transfer. The other person this isn't good for is somebody that is really thin and doesn't have any fat to transfer. So if you don't have the extra fat, then there's no way for me to use what you have to create your breast. So I need some fat, I need more fat than I can use to then get enough usable fat to transfer to the breast to really make a nice result. Can I get the same result as somebody that gets implants? And the answer is probably not. So with an implant, I can give you a 200 cc implant. 200 cc's or milliliters is the size of implant, and I'm going to put that in, and I know that it's going to fill that space like 200 cc's. Now, if I put 200 cc's of fat into someone, then number one, fat is a little bit more pliable. It moves around more than silicone does, and so it's going to change the look of that result. And I also know that I'm going to lose about 40% of it, so that 200 cc's then becomes 120 cc's. And so that's a big difference. The other big difference is that I can put a 200, a 400, a 500, a 700 cc implant in. And most of the time, the body will not accept that much fat. So you cannot get the same results as an implant, but not everybody wants a really exaggerated result. And so a lot more people are coming to me for these fat transfers. Those are the pros. So what are the cons of fat transfer? Now, what are the downsides of a fat transfer breast augmentation? Number one, we do need fat, and to do that fat, we have to harvest using liposuction. Liposuction can cause a little bit of soreness, and a breast augmentation actually is not a painless procedure, but really doesn't produce a whole lot of pain. So you'll have a little bit more pain with a fat transfer breast augmentation than you will with a standard breast augmentation. But the big issues with fat transfer breast augmentation relate to the fat loss and the consequences of that fat loss long term. So as we discussed earlier, I expect about 40% of the fat not to survive the transfer. And fat that doesn't survive a transfer basically gets dissolved by the body. And in the process of that dissolving of fat, you can get cysts that form in the breast, or you can get something called a macrocalcification, which is just like a microscopic kind of sign that some fat had died off in the past. Now, neither of these things are dangerous in any way, shape, or form. Sometimes a cyst can be a little bit sore. Many women have cysts in their breasts or fibrocystic breasts just as their baseline. But what can be an issue is that these cysts or these calcified areas can sometimes mimic the look of like a breast cancer on a mammogram. And that can be a cause of concern for some people. So a fat transfer cannot cause breast cancer. Breast cancer is caused by breast tissue, not fat tissue. So those are two different things. And in fact, I would say about 80% of people that undergo breast reconstruction after breast cancer are getting some fat transfer at some point in the breast reconstruction process. It's very safe. But what can happen is that it can look a little funny on a mammogram, and worst case scenario, that could potentially lead to a biopsy or something to see what that area is if you have one of those things happen after a breast fat transfer. Again, not dangerous, and this would also be rare that somebody would have a biopsy related to it, but it could happen. So we went over a lot of different things regarding fat transfer breast augmentation. If you have more questions or concerns, reach out to us in the office again. This is a huge topic right now. I'm seeing a lot of patients for this procedure in my office. I think it's a great procedure for the right patient. And so if you have questions, reach out. Thanks.